Well, good morning, everybody. Happy to be here. A lot of humanity in this room. I'm privileged again to be with you. Gosh, I'm supposed to talk about data and registries. It sounds pretty deadly, especially after a special morning like we've just had. But I want to try to put it in some perspective for you and tell you why it's important to hang in there for one more talk during this long morning. And that has to do with the fact that the last time we were all together at the Redmond, the last time I was with you, I was asked to come in and help a little bit in the defense against the attacks by the League of Cities on our presumption laws. And that actually is connected to the talk that I'm going to set up for my colleague, Dr. Gaitens. And that is that our defense of their attacks is in the data. Our biggest vulnerability in terms of defending ourselves from their attacks are the gaps in the data, are the inconsistencies in the data. And so my pitch is that we really do need to shore up our defense by filling in those data gaps. And that's what this last talk of the morning is about. So there's something in it for you to pay attention. So I'm going to start with some slides now. This outline is pretty bland, but it's just kind of basically get to what's important about the Wellness Fitness Initiative and collecting the data, sharing the data, and the benefits that we can derive from that. So this is not rocket science, as some of my friends in this room would say. Just to remind everybody, you know that this is a hazardous occupation, this calling that you have. It's hazardous both from a health point of view and from an injury risk point of view. We also know that just about every type of hazard that we study and try to prevent against in occupational health is found in the fire service. The chemical, the physical, the biologic, and the psychosocial hazards are all here. The Wellness Fitness Initiative is really put in place to protect y'all from those hazards as best we can. Part of the way we do that is this medical surveillance program that's intended to both preserve your health and your wellness and to keep you in really the best shape you can be in order to do this work. The Wellness Fitness Initiative, although is not just working at the level of the individual firefighter to keep you healthy and fit, but there's also a data collection piece to it that, when shared across cities, will form a registry of information that I said is the bulwark to our protection from the onslaught of cities that want to pretend that what you do is a cakewalk. So the purpose of the registry is to track the medical and the work-related and fitness factors that we can then map to health outcomes, and that mapping creates a data set that we can use to really describe what the health effects and the fitness outcomes and the injury data tell us about the fire service. We've had to kind of boil down a whole bunch of information that you all are asked to complete when you do participate in the Wellness Fitness Initiative. We had to come up with a minimum core set of data that we'd agree on across the cities that are participating would be the minimum we could get by with to define and characterize the health and fitness of the fire service and the members who participate in the program. So a subset of all those data that are collected were boiled down, and it's about 114 elements now that are derived from the examinations and from the questionnaires that you complete. We also were able to identify what those important and key data points were by reviewing the medical literature, by knowing what the known risk factors were for the diseases of interest. Those are the ones we know that are increased risk in the fire service, so that we could map those two pieces of information, and also allowed us to make validated comparisons with the experience of certain data that we derive from the firefighters in these wellness fitness programs, and then that can be mapped to the outcomes of interest, like heart disease, like certain cancers. So these were the elements that we came up with that are sort of the chapters, if you will, of this book that we're kind of writing together to define what the illness and injury sort of story is in the fire service. So we look at demographics, past medical history, your occupational history, which has to do with how long you've been in the fire service, what your job duties actually are, this sort of thing. Levels of physical activity, physical fitness, your own risk factors, your own health issues, and family history, and some lab data and testing that we obtain while you're in the clinic. So these are the elements that I just went through here, and you see that they all feed into a central data repository. It sounded sort of like Oz, where all the information goes to Oz, and we try to then study it, examine it, and come up with some kernels, some pearls that we can use to characterize what's going on in the fire service and also refute accusations about how easy a job it is that you all have. Dr. Gaitens, my work partner here, is in charge of that registry now, and she is working to basically give you a sense of what's possible when these data are shared in a meaningful way across cities that participate. Ultimately, we have a number of different potential outcomes that can come from this. The cancer registry, the infectious disease registry, that have been long-time products that President Schaetberger's been interested in for quite a long time, and the medical presumptions that we need to keep defending. So this registry is something that's going to have a lot of benefit, I think, to a number of different cities that participate, and also to the union, because we can use these shared data in a meaningful way to build these other types of registries and to defend the presumptions. So with that, I want to invite my colleague, Dr. Gaitens, to come up, and she's going to give you some specifics on what's in it for you if you do collect the data and participate and share the data.
Okay, good afternoon. So thank you, Dr. McDiarmid, for really setting the stage about what it is I'm going to talk to you about this afternoon. And so Dr. McDiarmid has done an excellent job in really describing what the Wellness Fitness Initiative Registry is about, what type of data is collected, how the data gets in there. And what I'm going to do is show you really how you can use the data that's in this registry to assess the health and fitness of individuals within your department and with the fire service as a whole. And the way that we do this is when you look at the data, it really is going to give you a snapshot of what your workforce looks like at any point in time. And this is the type of information that is being collected. You've got information on demographics, employment status, overall health status, illness, injuries, cancer screening, and the list goes on. But in addition to telling you where you are at any point in time, you can also identify trends over time. And so this is really important in understanding where it is you've been in regards to health and fitness, where you are now, and what direction you're heading. Oops, if you can go back one slide, please. Another one. So this is an example of some of the questions that we can ask using the data that's collected in the registry. You can ask very simple questions, such as what health conditions are common among fire service members in our department. This can be really useful information when you start thinking about the health services that are needed. You can ask more complex questions, such as do firefighters have increased risk of heart disease when considering other risk factors such as age? Or are there an excess of cancers among firefighters compared to other populations? And you can also use this data to help you identify opportunities for improvement. So what I'm going to show you now is actually data from 2 different fire departments that have been submitting information. And I can tell you that there are records for 918 firefighters already in this data set. And so this is what we have as being reported to be the most common health conditions for this population. And when you look at this slide, there's a lot of information on here. You can look to see what are the most common conditions ever being reported for this population. And you can also look to see which conditions have been more commonly reported over the past year. Now, we know that many states have presumptive disability laws, and we know that certain cancers are one of the things that are covered by some of those laws. And we have to ask the question, so what type of data needs to be collected to help strengthen and support these laws? And so here's some information that just shows you the number of fire service cases within this population of 918 individuals. And when you look at these numbers alone, it doesn't tell you a whole lot. Really, the question that we want to ask is, how do these numbers compare to those within the general population? And to be able to answer that, we have to have a lot more information. First of all, we need a much larger sample size. Although 918 records is very exciting to many of us, at least those that are involved in data analysis get excited when we have that many numbers. But when it comes to cancer and very rare outcomes, we need to see that sample size increase, because that's really the only way we can tease out whether or not those in the fire service have excess cancers compared to the general population. So a big concern for any fire department is the occurrence of injuries. We know that injuries are very traumatic for the individual, as well as can be traumatic for the department, because they are the ones that bear the cost of lost work time. They have to deal with workmen's compensation and threats to adequate staffing. And so you can use information that's captured in this registry to answer or to start asking questions like this. What types of injuries are most common in our department? Are injury rates increasing or decreasing over time? Have injuries decreased since implementing our new departmental program aimed at reducing injuries? These are just a sample of some of the types of questions you can start asking. Now, because data is being collected in a very systematic way, it makes it possible to compare information across sites. And so this is, again, real data from the 2 sites that have been submitting information to the registry. And you can see some interesting things jump out on this graph. And the one question that I would ask is, if you look at the kind of the middle clump of bars there, this is information from the 2nd site. And you can see that they have a much higher % of the population ever reporting being diagnosed with a back or a knee injury. And so this raises the question, okay, well, what's accounting for that difference? Is it because Site 2 has older individuals, which may put them at more risk for injuries? Is it because this is, the site has people that have been working in the fire service for years, which may have put them at increased risk for injuries? And you can tease part of that out by using the data in the data set, and I can tell you that I did look into that, and indeed, these statistically significant differences existed even after controlling for age and years in the fire service. So then you have to ask the question, what else can account for these differences? Is Site 1 doing something different? Do they have a program in place that really is responsible for the differences between these 2 groups? Now, here's a little disclaimer. This is the only slide where I'm not showing you real data. It is based on real data, but we don't have data yet collected for a 4-year period. Okay? But I did want to put this in there because I think it's really important to show you what type of stuff can be done when we start collecting information over the course of time. And when you do this, this is the percent of population experiencing a back injury within the past 12 months. And you can get a lot of information out of this very simple graph. You can look and you can say, wow, Site B has a much higher percentage of the population experiencing or reporting a back injury within the past 12 months, especially compared to Site A, which is the dark blue line. But you can also look and you can say, well, at least Site B, we're relatively stable, although it looks like we're starting to, or we're continuing to increase over time, not the direction that you would want to head. But then you can say, well, I'm with Site A, so it's good news that we have a lower percentage of population experiencing a back injury, at least for 2008, 2009. But you have to ask the question, oh, that moved. That arrow is supposed to be right underneath that big jump for 2010. And so you have to ask the question, what happened in 2010 for Site A? Why did the number of back injuries almost double during that time? So a lot of energy and a lot of money is being placed into screening health promotion and fitness programs. And why? Because it's the right thing to do and it makes sense. But do we actually have data to support the effectiveness or to show the effectiveness of these programs? And so here are some questions that you can ask using the data captured in the registry. You can ask, how many cancers have we detected early through our screening program? Was our flu immunization campaign effective? Are we adequately protecting the health of our EMS workers? Since implementing a new fitness requirement, has fitness overall improved? So let's take a look at some of this screening data. And we know that current recommendations say that males over the age of 50 should have a PSA test yearly. And you can see this is real data from the two sites, and you can see that 87% of the males over age of 50 have indeed had a PSA test within the past year. So it's not too bad. And you can see out of that number, 3 individuals had an abnormal PSA result. So what does that mean? Well, those are the number of prostate cancers that you have potentially identified and caught early. Now for women, we know it's not as clear-cut. There's some debate about when women should have mammograms. But let's say that everyone agrees that women over the age of 40 should have had a mammogram within the past year or on a yearly basis. You could do the same type of analysis with these data and see that only 30% of the women over the age of 40 had received a mammogram in the past year. And so what does that tell you? That tells you, when you see that number 30%, that this is a potential area where you've got a lot of room for improvement. So let's say that these two departments that had been collecting data, and I don't know if this is true, but let's say that they had really gone out and had a big campaign to talk about being immunized for the flu. Well, if they did such a campaign, they could use the data captured in the registry to say, well, how many people have actually received an influenza immunization within the past 12 months? And you can see about 50% of the population report having a flu vaccine. And so I don't know what you guys think of this number, but I can say, given the interaction that you have with the public and the amount of time that you guys spend working together, I don't really like that number of 50%. So I would ask the question, well, who's more likely to receive the flu vaccine? Which population are we reaching the best? And so this is just broken down by a description of current duties, and you fall into one of 3 categories within the registry. You can be management or administration, EMS paramedic, or fire suppression. And so when you look at this, you see that close to 70% of management has gotten the flu vaccine, but less than half of those involved with fire suppression have been vaccinated. And really the question becomes, well, who's more at risk? Who should be the ones getting the vaccine? I see my line here moved again. But because this whole concept really stemmed from the Wellness Fitness Initiative, I'd be remiss if I didn't show you some of the fitness data that is also captured in the registry. And so this is a distribution of the scores that people get on the Flex-Sit test. And I'm sure many of you know much more about this test than I do, but if you don't know much about it, it's my understanding that you sit on the ground with your legs straight out and you reach forward as far as you can. And it's, your score is the number of inches that you are able to push a little bar forward. You can see here that on average, people are able to reach 15 inches. But you can see that some people do quite well, do much better than that, all the way up to 25 inches, and then some people do much more poorly on this test. So then you can ask the question, well, who does better and who does worse? Well, we know that in looking at this data, you can see that, well, I'm not going to show you the data, but in looking at this data, what I did was I looked at it and found out that indeed age predicts how you do on this test. BMI predicts how you do on this test, as we would expect. But then you can also do more with the information captured in the registry. And you can look to see the number of days per week that people report doing different types of exercise and compare that to how well, or the predicted score that they would be expected to receive on this particular test. And you can see that those that are involved with strength training and do that many times per week tend to do better on the test than those who do just any type of exercise at all. But the good news is any type of exercise that is done will improve your score on this test. So what I hope I have shown you is what a valuable tool the Wellness Fitness Registry can be, and that this registry really can help you assess your staffing and department readiness. It can help you focus health promotion and fitness efforts. It can help you assess overall health status of your population, identify areas for health and fitness education, assess effectiveness of screening, health promotion, and fitness programs. You can use the data to compare departments to others, which may lead to identification of best practices and rooms for improvement. And the information that's captured in this registry can help inform and support policy decisions that have an impact on the overall health and fitness of firefighters. And with that, I would like to thank you for all that you do and for your attention this afternoon.